Good afternoon, everyone. It is a great day in the state of Missouri. Beautiful day out there. Hope a lot of people are out there enjoying it today. Again, let me just say this. I am thankful that the protests this week have remained peaceful across the state as they continue. Today, I had the chance to meet with community leaders from Kansas City, St. Louis, and Columbia. An initial meeting with a lot of young activists that were involved in a lot of protests across the state. It was our first meeting, a little bit of a meeting to get to know one another a little bit and kind of really be able to talk issues, to talk about some of the things most of you have already covered, I will say that, and then how do we move forward. So that was the initial conversation, and then we will be having a follow-up meeting to discuss some of those issues at that point. And there were some issues I want to say that that we're not going to agree on, so some different things. So I want to make sure I'm clear of that. But again, it was a process of starting a conversation to see things, what we can do and what we can do. And I appreciate their time, and I value their opinions on that. As you know, Phase 1 of the Show Me Strong Recovery Plan expires this coming Monday on June the 15th. It is truly incredible to think how far Missouri has come since March. At that time, no one knew what to expect. There was a lot of uncertainty, worry, and concern. Concerns that our hospitals would be overwhelmed and that we wouldn't have enough ICU beds and ventilators. Concerns over PPE shortages. Concerns that testing wouldn't be widely available, and many, many other concerns. Here we are today, just over 90 days since our first case in Missouri. And I am so proud of our Missouri citizens, our Missouri companies, and our communities across the state for doing their part and using common sense. Thanks to you, we have overcome all of these challenges and more than met our 4 pillars of reopening. Pillar 1 was testing. We went from testing only a handful of people each day to an average of approximately 10,000 tests per day over the last 2 weeks. Since April the 20th, weekly testing has increased more than 220%. Pillar 2 was PPE. We continue to receive and distribute PPE across the state, and we received national recognition on the Google PPE Marketplace, which we currently have over 100 hospitals, 436 suppliers, and more than 1,500 healthcare providers, Missouri businesses, and other organizations registered in this marketplace. Pillar 3 was hospital capacity. Our hospitals were not overwhelmed, and we converted a hotel to a hospital in just 11 days, thanks to the Missouri National Guard and the Army Corps of Engineers. And if somebody would have asked me, Governor, was it possible to put a hospital in the state of Missouri in 11 days when this all started, I would have probably tried to look at them like, you got to be kidding me. And we did. And that's because of hard work, and people knew what the job ahead was and how much it meant to the people of the state to protect them. From May the 1st till yesterday, June the 10th, total hospitalization has fallen by 43% statewide. As more people recover, ICU beds and ventilators become available. Pillar 4, the data. And let me just, before I start on the data, just remember when we first started out, one of the most difficult obstacles I had as governor of the state of Missouri was getting information to make decisions. There was a lot of national models out there that frankly were pretty inaccurate and wasn't doing us much good. And finally, with the resources we had in the state and coming together with a plan to say we need to take care of Missouri first, and that's when the Pillar 4 the data becomes so important to make decisions, and we continue to use that data today. So we went from having Missouri-specific data to an entire dashboard of data from across the state. And I want to thank the Department of Health and Senior Services, the Infectious Disease Doctors Panel, Washington University, MU, and many of my directors involved in helping us gather Missouri data. We have learned and accomplished so much since March. Knowing what we know, we are much better prepared to deal with COVID-19 going forward, which is why we are confident that Missouri is ready to take the next step forward. Beginning Tuesday, June the 16th, we will move into Phase 2 of our recovery plan. Phase 2 will be no statewide order. Missouri will be fully open for business in the entire state of Missouri. Local officials will still have the ability to further measure or regulate in places, but from a statewide stance, all restrictions will be lifted. We know that there have been lots of questions and concerns regarding nursing homes and veterans' homes. The state of Missouri and our partners in long-term care are committed to assuring health and safety of some of our most vulnerable citizens in long-term care facilities throughout the state. Since the beginning of COVID-19 crisis, our long-term care facilities and our veterans' homes have put restrictions in place regarding visitations. We also continue to take aggressive actions with our box-in testing strategy when a positive case is identified in either staff or residents. We're grateful to our long-term care facilities and Veterans Commission for their work and recognition of the importance of testing to keep our loved ones safe. At this time, the Department of Health and Senior Services is working closely with the long-term care industry to issue guidance on safety and logistical reopening long-term care facilities in a way that aligns with the situation in each community and individual facilities. We expect to publish these recommendations within the next few days. I want to thank each of you with a loved one in those facilities. We know we all share the same desire to keep them healthy, both physically and mentally. As we fully reopen in Phase 2, we will be extending the emergency declarations through December the 30th in order to utilize the CARES Act funding. I have also extended 4 previous executive orders through December the 30th, which are Executive Order 20-04, waiving or suspending over 530 regulatory burdens. Executive Order 20-06, mobilizing the National Guard in our response efforts. Executive Order 20-08, waiving the requirements for a person to be physically present in front of a notary public. And Executive Order 20-05, allowing the sale of unprepared restaurant foods to the public. Extending these orders is inconsistent with the emergency declaration and give Missourians time to adjust as we reopen and work through the recovery process. We have full confidence that Missouri is prepared and ready to move forward. But I want to be clear, just because we're fully reopening the state does not mean that the steps we've taken so far should be forgotten. The virus is still out there, and it is still extremely important for everyone to continue social distancing. And we need to be proactive, avoid large congested crowds. And if you can't social distance, take extra precautions to protect yourself and those around you. We all know how to do this at this point, and it is up to us to take personal responsibility for our own actions. The health and safety of all Missourians will always be our number one priority. But as I've said many times, COVID-19 has had a devastating impact on our economy. We have met the 4 pillars. We have accelerated testing. We know that our preventive measures needs to be taken, and we are prepared to deal with any potential outbreaks or hotspots. Now is the time to begin repairing our economy and getting Missouri businesses, communities, and citizens back on their feet and back to work. Today, Director Dixon is here to talk more about our plans for the economic recovery. Rob?
Thank you, Governor. Hi, I'm Rob Dixon. I lead the Missouri Department of Economic Development. As we take this next step towards economic recovery, it's important to remember that the public health response and the economic recovery for our state are two sides of the same coin, and as we deal with the impacts of the virus, we'll have to address them both as the governor has outlined. We simply cannot have one without the other. Today's action is due to the work that so many people on the front lines of the healthcare response have done to strengthen those key healthcare pillars that the governor touched on. You know, we've worked hard through common sense measures like social distancing, good hygiene, and the restrictions in the previous orders. And our teams have been working with employers across the state to make sure that they have the resources that they need to protect their workers and their customers. And what we've heard from businesses across Missouri is incredibly encouraging. Of the employers that we connected with, 82% have implemented screening and other health procedures for their employees, and 78% have a plan in place in the event of an outbreak. This planning and continued caution is incredibly important, even as the health order expires. We have to be vigilant to prevent future outbreaks and to keep our economy open. We also encourage businesses to develop a plan for testing and contact tracing, and many thanks to those businesses that have already done so. But I also wanted to talk a little bit today about some of the signs that we're seeing in the economy, and those signs are pointing towards a recovery. Companies are beginning to call workers back that were laid off, and we're seeing a decline in the ongoing unemployment claims. They were at a peak, a historic peak of 440,000 to now fallen down to 350,000. At the worst part of this event over the course of the spring, Missourians that are employed in small businesses such as restaurants and retailers worked only about 50% of the hours that they normally worked in January. The most recent data that we've seen shows that we're down now by a little more than 20%. Still down, but moving in the right direction. At the end of April, another survey that we conducted showed only 5% of small businesses were seeing increases in revenue. That was in April. The latest data shows that has climbed now more than 15%, showing an increase in revenue. At its lowest point, credit and debit card spending on consumer goods had fallen to roughly 35% since January. And now we're back to nearly 5% of where we were back in January. Finally, we're encouraged by strong upticks in job postings in some of the hardest hit industries across our state, like leisure and hospitality. So even though we have a ways to go on the economic recovery, the bottom line is that our economy is coming back. To track our progress and to keep everyone informed, we've launched a new economic recovery dashboard with many of these measures. We've talked about this over the last few weeks in particular. You can find it online right now at showmestrong.mo.gov/dashboard. That's showmestrong.mo.gov/dashboard. It's going to take all of us, the public sector, the private sector, our nonprofit and community sectors working together to bring the economy back, and that's what's happening right now. Today's news by the governor is a tremendous step toward our state's economic recovery, and we truly appreciate the governor's leadership on these issues. The governor's Show Me Strong recovery plan focuses on helping businesses, communities, and citizens, and it is working. We want to get Missourians back to work. We want to make sure that we're eliminating barriers to business growth so that they can return strong. We want to help local governments and nonprofit organizations access resources, and we want to help invest in our state's infrastructure in ways that drive job creation across the board. You know, before all of this started, our economy was strong and getting even stronger. And as the governor has said, COVID-19 is not gone, but we do know what we need to do to protect ourselves and each other. And as a result, today we're able to say that Missourians are getting back to work. And that's what today is all about. Thank you, Governor.
Thank you, Director. Also, Director Williams is also here today to answer questions here shortly. The Director always makes me pretty careful what I say up here when it comes to new announcements and stuff, but let me just say I think there's some good news on the way that the Director will be able to share in the weeks to come for the state of Missouri. I think before this all took place, there was a lot of people interested in expanding in our state and coming to our state, and I think those people are still out there, and we're going to see some signs of that in the near future. One other topic I'd like to bring up real quick today. I know Brian's here, and I'm sure he's going to ask me the question if I don't say something about it, so I might as well get it over with. We've been in discussions with the State Fair Commission the Director of Agriculture trying to figure out what we was going to do at the state fair. I'm not sure we had a plan finalized with exactly how we were going to go with that, but I think it's kind of out there that the governor said something about going to have the state fair. So let me just kind of make it clear what we're going to do there. The state fair has only been canceled one time in over 100 years, and it was during World War II. As a ag governor, I guess I want to say, somebody that comes from the farm, I don't want it to be the second time on my watch that it's canceled. The state fair will go on, some version of the state fair. There may be some things that don't happen that normally happen there, shorter hours, less days. I don't know what that looks like yet, but we will have some sort of state fair. And I'll go back to what I've always said about this state fair. You need to remember the core values. It's about youth and agriculture and sport and agriculture. So my direction is get back to those basics, do what we got to do, and maybe some of the other things we won't do. But anyhow, we want to do it and be as safe as possible, but we plan on having a state fair here in the state of Missouri. So that being said, and in conclusion, I'd like to say that we are fully confident that Missouri is prepared and ready to reopen. But we must remember that COVID-19 is not gone. Use common sense, practice good hygiene. If you feel comfortable wearing a face covering, then wear a face covering. Be proactive and take precautions to protect yourself, your families, and your neighbors. And above all, continue social distancing. At some point, government has to get out of the way and let people live their lives and regulate their own selves when it comes. We are at that time in the state of Missouri. And I know Missourians will continue to do the right thing. And I know that together Missouri will recover and come back stronger than ever before. And I just want to say and finish today how much this means to me when I say it. But I mean this. God bless you. God bless the great state of Missouri. And God bless the United States of America on that. So, Kelly, let's open it up for questions.
All right, Greg Dixon. All right.
Okay, thank you.
All right, Dr. Williams.
I just want to add real quickly to the governor's comments. This is just a huge day for Missouri, if not to me, the country. I've done interviews already today with national media outlets and appreciate you being here, but just incredibly appreciative to the governor and all the other cabinet members and the people at DHSS and our local health directors and our provider community, the hospitals, and most of all the citizens of Missouri that have enabled us to get to where we can do this. And I'd be happy to answer questions about that. But just want to reinforce what the governor said. I've had some people call me that while this is a huge milestone, the basic principles of public health, social distancing, hand washing, if you're going to be in close contact wearing a mask, those basic public health principles will persist, and we want people to engage in those. We've worked so hard to get to where we are. We just do not want to, through a lack of vigilance, backslide. So thank you. Happy to answer any questions.
Hey, Dr. Williams. I've heard from some local health officials who say they've reached out to DHSS for support on contact tracing efforts. Do you have an idea of how many requests you've gotten, and have you had any difficulty in responding to them?
I know that the one that comes to mind is we responded to Kansas City because they've had a slight uptick in cases. Other than that one, I'm not familiar to anybody who's reached out to us that we haven't been able to help. But if you know of any, would certainly like to follow up. You know, feedback is how we get better. But certainly, we're all in the process of ramping that up. I was in St. Louis yesterday talking with Spring early in the morning, and they've hired 45 and are hiring 55 more. So I know that the locals are doing what we're doing here in Missouri, which is gearing up, because contact tracing and testing go hand in hand. They're kind of hand in glove. The testing enables you to do that. So if you know of any particulars that I've missed, please let me know.
There was another reporter at my paper that asked for an update on the Lake of the Ozarks situation.
Yeah. Mm-hmm.
Do you have any update on that?
Yeah, Jack, thanks for asking me that. I've been asked that by several people who have called me, and it's just very important to understand how contact tracing works. You know, if we have a congregated facility or an isolated contained area, then in a community, then it's fairly easy. And the one that comes to mind is down in Springfield with the hairdressers. We had a list of 150 people we could call. So when we say we feel like we've reached out to these people and we tested 47 and they were negative, we feel pretty good about that. When you have an incident like Lake of the Ozarks where all these people come in and then leave, it's not as simple. There's not a list you can go pull off and check off the names. So people keep asking me, well, how would you know? I mean, you say to your knowledge, you don't know. And I've heard someone from the press today mentioned another person they had heard of, and I've got a phone call in, and we're just trading phone calls to try to run that down in another county. But how this works for us is that we depend on contact tracers. Let's say 10 people had become positive from there, and that's just hypothetical. Then when they go back to their communities and they're identified as positive, the contact tracers, whether it be in St. Louis or wherever, go in and say, where have you been? What have you done? And if they say, well, I went with 4 of my friends somewhere to a concert or something, and you check those 4 people and they're positive, then you work backwards to the event and notify the event, oh, by the way, we have a cluster that attended your event and turned out positive. We have no knowledge of that yet. But to your point or others, that's more of a reactive type of contact tracing than one in which we have a list that we can work off and go for.
So, but you haven't confirmed any other cases from Memorial Day weekend?
I have not. I've talked to Bee down in Camden County, and she's not aware of any. I have a phone call into another county in Missouri that it just came to my attention there might be a case and asked me to follow up on, and I'm doing that today as soon as we can connect.
Hi, Doctor. If
Hey,
there
Phil.
are spikes in other states, especially large ones like California and New
Yeah.
York, and there's another spike in demand for PPE and test kits, are we prepared for that increased competition?
Well, I think, as the governor said, the way I would make the analogy is we have worked really, really hard in Missouri to have our PPE ready to open back up. Now, I don't think anybody in the United States would say that we have an infinite supply for September or October, and I think that's why the governor is so committed as we move through the summer to use Missouri businesses to get us to a stockpile that might deal should we have any sort of resurgence. So listen, when I look at where we are now, where we were 7 weeks ago, it's exponential. So it's like everything else we say. Are we going to continue to work to improve whatever we're doing, whether it's testing or PPE or our data? Absolutely. We're going to continue to work to improve.
Thank you.
Director, to lift the statewide order, there were markers as to move, the 4 markers to move to phase 2.
Yeah.
Has the department or the administration gamed out a scenario in which a statewide order would be snapped back into place? And what does that scenario look like?
Yeah, thank you, Crystal. The things we look at very closely every day is our R0, the infectivity rate in the state, and right now it's at about 1. Different regions a little bit different, and so that's incredibly reassuring. You remember when we started out, it was about 2.86, and now it's at 1, which is flat. Second thing we look at real closely is our hospitalizations. We look very closely at that. And ventilatory use, and so we're watching those things. We also look for outbreaks. We look for clusters. So we'll be watching our nursing homes carefully, and so we watch that. We have incredibly robust data by county, by region. So there's not an algorithm. There's not a tripwire that of any one of those things. As I've always said, our whole goal is not to treat the chart, but to treat the patient. And so we every day get up and look at all that data across the state, regionally, statewide, and then would make a holistic decision should we see something emerging. And we don't wait for it to emerge. we're being incredibly vigilant with our testing to go out and seek it out if that's happening.
For the first marker that you provided, that we're at 1, what would be an alarming number for you?
Yeah, I think, we started out at 2.86. So I think anything over 2 would be something, but again, we follow it regionally. So it's conceivable we could have an R0 bumping up in one region but not another. And so when you talk about R0s, we don't even leave it to the state. We're looking at regions to kind of take that into account.
The hospital that was put up in North County in the St. Louis area, is it still functioning? And is there any, if it's not, or if it is there any idea if it will close or will it continue through one of these orders to the end of the year?
I don't know the exact status of it at this very moment. Director Karsten is in charge of that. I know that it was winding down, but I just don't know the answer as to its exact status as of today.
Was there ever an estimate on how many patients were seen at that hospital?
I can get that to you, but again, Director Karsten was in charge of that, and she's not here today, but be glad to get you that information. I think, the significance of that, as the governor said very eloquently, I thought, was that who would have thought 3 months ago that you could stand up a hospital to take in overflowing COVID patients in 11 days or 12 days. And that is a muscle that we need. And so we know we've got that muscle now that we can do it should we need that going forward. So that's incredibly important to have in our toolkit as we move forward and feel good about things that we now know that we can do that in 11 days.
Hi, Dr. Williams. I'm kind of switching gears here. So you mentioned it's super important that we have our own PPE supply. There are 2 professors at Mizzou that are researching the spread of the Spanish flu back in 1918 and comparing it to COVID-19. How important is it for us to do our own research here in Missouri?
Well, I think that's, if you ask me, kind of differences between us and other states. I think one thing is we very rapidly stood up our own data analytics here in Missouri. I can remember, being with the governor and being frustrated because there are this data coming from the West Coast and the East Coast, frankly, Boston and Washington State, that I was watching very closely, and it just didn't seem to fit with what we were seeing on the ground. It was like, wait a minute, they're saying this, but that's not what we're seeing. And so when we look back at just kind of how we arrived at this day, and incredibly fortunate and blessed to be at this day, I think, to your point, it is that we have used our academicians here in Missouri, at both at the University of Missouri and WashU comes to mind. I know that the governor and I have found it incredibly helpful to have now, I think, 12 weeks in a row, conferences with ID doctors, infectious disease doctors from all over the state. We do that every Saturday. I just think that when you look at us compared to other states, and I can't speak to them completely, but I think the fact that we very quickly moved into a Missouri, we would rely on Missouri and we would use our resources, our skill sets, frankly, some of our own genius to get to a better place. It has served us very well.
And
just ballpark, do you know how many people DHSS has in terms of contact tracing that it can provide to local health departments? And are there any plans to ramp that up?
There are, and I don't know. I saw a new number the other day, and I can get that to you, but I don't want to give you one that's incorrect. But again, as you know, that is something that I've answered that question before, that we are looking at best practices. We think it's really important. And as soon as we're able to roll that out, we'll share that with you. Thank y'all.
All right. Let me cover a couple of things. And I don't know who asked the question a while ago, but it was on contact tracing. People had contacted for help. I don't know who asked that. But let me just say this about the contact tracing part of it. We will play a support role in the state. Most all counties have received funding to help with that through the CARES Act, where that's testing. So if those counties have funds available, they should utilize those funds. And then we would come in a support role if they have funds to do their contact tracing. If you look at the main areas such as Boone County, Jackson County, St. Louis, all the big areas, most of them have pretty aggressive health departments and are extremely understand contact tracing and can do that. So what we want to do is be in a support role for them to help them with that when people call. So the first thing they've already been funded to be able to utilize funding for that. If they run out of that money or it hasn't been used, then we'll be there in a support role. But again, I think I want to clarify that we're in a support role. We're not going to come in here and take over contact tracing unless for some reason they can't do it. The other question was asked about was the hospital in St. Louis, the temporary hospital we had. It is still there. There was very few patients that were ever in that hospital, to be right honest about it, and it still continues to be there. And the reason we had it there, if at the time it was pretty well in the height of what was happening with COVID-19, with our nursing homes up there, with the African-American community. And again, we wanted to be prepared at the time. And that's why that was in place and why we put it in 11 days. We still want that there just in case we do have an outbreak, if something unforeseen would happen. We don't believe that would, but it's going to be in place for a few more months to see how we move forward. But again, it's more of a security blanket than it is anything right now. So with that, questions?
Go ahead. Okay. The legislature passed a bill that would authorize electronic monitoring in nursing homes. Do you have any concerns with that bill?
I haven't even seen the bill yet. I don't guess. I don't know if that's in the review process or anything. I don't know what all it says. I mean,
okay.
Yeah, and I guess maybe to ask you, what do you mean by monitoring in the nursing home? Monitoring and how?
By patients of their rooms. They would monitor their rooms with video.
I'm not for sure on that, whether we've had that discussion or whether I've seen that legislation. I'm not sure.
Okay, and then you attended a fundraiser in December that was also attended primarily by nursing home owners and industry interests. Does their financial support of your election influence your thinking when it comes to limiting COVID-related lawsuits against nursing homes?
Oh, no, it has nothing to do with that. I mean, on the lawsuits, I don't know who the lawsuits will be directed at. It'll be the hospital, the doctors, the nurses, people that were in emergency row, people who are first responders. I mean, there'll be a lot of people on the front line, but it has no influence whatsoever on that situation.
Yeah, Governor, thanks for the opportunity. I have two questions, one on the state fair and then one on possible special session, because I heard you on our affiliate in Moberly today about the fair. So You mentioned that there will be a fair. Not sure of the details. Are they still looking at the same dates? And do you know if there'll be a ham breakfast? Can you answer that first?
Well, I doubt there'll be. Well, I'm going to give you my opinion. Sure. I doubt there'll be a ham breakfast because it's the governor's ham breakfast, so I doubt that I'm going to be asking for that, that I know of for that. Again, we were kind of in a pre-conversations of this when it kind of got out that we were planning on that, so we're still in the process of planning that. And let me give you an example. I don't know whether more than likely there's not going to be concerts there. There maybe not be a lot of vendors there. But again, we haven't sat down with Mark Wolf and the commission, so I don't want to jump in front of them. We're all trying to plan that together to see how that might look. So,
gotcha.
So I'll just be careful what I say about it.
And I understand that. And then finally, former Senator Shields at this week's State Board of Education meeting mentioned that there's a possibility of a special session in September. He mentioned we have snow days, we don't have COVID days. He indicated that could happen in September. Can you comment on that, Governor?
Yeah, let me say, a lot of questions on special session. The chances are there'll probably be some sort of special session. When that'll be, I don't know when it'll be, and I don't know whether it'll be 1, 2, or 3. I don't know. It depends what these issues are that we're going to be dealing with. And again, I think it's important to know we're going through the legislative process right now, reviewing all these bills and some of the questions that you just asked me. Till we get that done and see what we've got and what we need to do pushing forward, we'll see what's in the special sessions, what that call would be. But again, I don't think I'm at the point yet where I can say what the dates are and how many times and what the issues would be.
Governor, you started your remarks today about mentioning a meeting you had at the mansion. And so sitting down with those activists and people around the state, what message did you take away, and what kind of requests were you hearing?
Yeah. Well, first of all, it started here in the office. We come to the office, had an initial meeting. We went over there and had lunch is what we went to the mansion for, and continue that discussion because there's a little bit on limited time. One, it was good for me to hear these young activists to really try to figure out what it is that they were, you knew what they were upset about, you know what the protest cause was, but what's the end game? Well, what are we trying to do at the end of the day? Are we, whether that's education, whether that's better health care in certain communities across the state? Is that job training? Is that making sure people are safe? Although we're talking about that, is a lot of things. They had a lot of things on their mind too that they wanted to talk about. They brought up the things that most of us already been covered, defunding the police, and there's going to be things like that we're not going to agree on. Racism was brought up in that, the core of that, and how do you change that, the way we do things. So again, I want to tell you, it was an initial conversation I had with them to try to see what it was. If there is places we can agree, how do we move forward? If there's things we can't agree on, we're just not going to agree on it. But I don't think there probably is not a whole lot of people sit down with them and listen to them. They're young. A lot of these young activists were that I talked to, but they got the potential, some of them, to be true leaders.
What do you think was the most striking thing said to you today?
Well, I think, my opinion was I'm not sure they knew what to expect when they come in here, and I'm not sure they knew what the governor could do and what he couldn't do on that. So there was a lot of conversation about that, and I think to have the ability to be able to share their concerns, their voices, I think they wanted to do that. They wanted to do that. I'm not sure what their take of it was when they went home, but all I know is we agreed to do a follow-up meeting on some things, and we'll go back and we'll meet with them at some point.
Hi, Governor.
Hi.
MoDOT is cutting pay for its staff and employees. Do you know of any other state departments that are doing the same thing?
Yeah, I mean, a lot of that's going on throughout there. I mean, all the departments are being asked to make reductions. Whether that's through employees, whether that's through different resources we have to cut the budget. We're going to have to. I mean, I'm going to have to withhold funds from the governor's office. I mean, I can't go out there and ask every department to make sacrifices and leave the governor's office or the legislators' offices clean. I mean, we're all going to go through this together. So there's going to be withholds. There's going to be reductions for everybody, and like I said, including the governor's office.
And then on phase 2, where do large events fit into that? Things like sports, concerts, large venues.
Yeah, I think that goes back to the entities that's going to have them. How is that going to look, and what are they going to do? Look, I think most of the large events, well, let's take professional baseball, professional football, concerts, is going to be driven by the consumer. How many people are going to want to go there? And I don't know. I don't know if 70,000 people want to get in a football stadium and sit side by side, or whether they don't. My feeling is they won't. I think there'll be some sort of I think there'll be some sort of adjustments to the seatings or how you keep people spaced apart. But I think they already know that. I've talked to the Major League Baseball, the NFL, hockey. I mean, most of the pro organizations, and I know MU and the universities, they're going to have to be thinking of how they're going to handle that. But I think they'll do that internally, but I think it'll just create its own kind of security. Look, people's not going to go there if they don't feel safe.
Thank you.
Online.
Hi, Governor. I know when you extended the order, the phase 1, you mentioned you wanted to get the state all kind of on the same page, getting to be just kind of on the same page. Right. So where, and you were talking with local leaders, so what are you hearing from local leaders about where the state is just kind of as a whole, and how they feel about reopening?
Yeah, well, I think it's really important that everybody understands I didn't do this without contacting county executives, local leaders, and the mayors across the state. It was one of the things we reached out to them first, tell them what we were going to do. For the most part, positive reaction from most everybody. Everybody understood. I think everybody realized that people are wanting the state open back up, and they want to go back to a normal life, and what would be what we consider normal. But no, they're all aware of it. The mayor's aware of it. The county executives were, and everybody we talked to was in favor of some sort of. Some of them are working their way that way anyhow. Some of them went from 25 to 50 to 75, different formulas. But I'm telling you, I think everybody in the state knows it's time to open up the state, and that's what we're going to do.
We'll take one last question, guys.
Thank you. Hi, Governor. So you mentioned that as governor, when you're talking with these activists, there's some things you can do and there's some things you can't do. Could you give us an example of something you can do to address the concerns they have versus something you can't do?
Yeah, I think you can take a look at things, for example, on whether it be the education issues, whether it be the crime issues, things that we have actually done prior to that. You know, one of the things that I mentioned to them today, and you know, sometimes it's always about communications, a lot of times, who does what. But we had taken a lot of action before that some of them didn't know about. For example, what we had did as far as the crime witnesses, where we were trying to protect witnesses to be able to testify in serious crimes. What we were doing for armed criminal action with juveniles. What we were doing to try to keep people in their neighborhoods and utilize the churches to help with job training, to help with those things. Those are the kind of things that I think were important that we've been doing. But I'm going to tell you one of the things that I did early on and had no idea that, you know, this was long before the protest ever come and for this issue happened, was establishing relationships shortly after I became governor, whether it was Better Family Life, whether it's some of the communities in St. Louis or Kansas City or these areas. We reached out at that time trying to really understand what is it can I do? And we walked through some of those things. I think prison reform, some of the criminal justice reform we did, is a big issue. I mean, that was one of the issues we talked about, was people in prison, you know, about doing things. And I don't know if they did or they didn't, but I don't know if they knew the reduction we had made in the prison systems since I've become governor, and that we're trying to get those people back in the workforce. So, again, I'm going to go back. It has a lot to do with communication, trying to open that up. And that's what we did today. It was opened up. I don't know that I said things that made them happy about everything. I know, you know, when you talk about defunding the police department, we're going to be on two different levels of views on that, totally. And you got to be able to sit down and say, look, I don't agree with that, you know. And then you got to start, what can you agree on, and what are those items? And that's kind of was that phase today of what I sat down with them and try to figure out. You know, we'll see what happens out of it. I'm not sure what their reactions are to it, but they'll have a view of it. One thing that they wanted to make sure it wasn't a publicity stunt or anything like that. And, you know, the one thing we didn't do, we didn't invite the media or anything to it. I wanted to meet with them, and I wanted to hear these young people's concerns and see if there was something I could do on that. Listen, thanks, everybody. I hope everybody has a good weekend. Go out there, enjoy the rest of the day. I'm glad Missouri's back open. I think it's time for us to move forward, and we will surely do that. Thank you very much.